Good morning, friends. Welcome to this National Symposium on Practice Management. I think one of the very important subject to be discussed, and my job is to talk something on the policies the government makes for eye health, because we know that health policies, as far as the government is concerned, is a very small priority. On that, ophthalmic priorities are still smaller. But in last 7 decades, India has progressed. Similarly, the policies for eye healthcare have also improved. And in fact, it's not that we have not done something good for country. We have really done a good work in this area and achieved so many things as such. No financial disclosure for this particular talk. Why there's a need of eye health policy, at least from the government point of view, because we know that India has the one of the largest people living with a visual impairment, and that's a very significant number. If you look into entire world, India would have almost more than 20% population of entire world with a visual impairment. And once we have a visual impairment, friends, it really takes the country towards a poverty. And improving the health of a person depends on the eye health, because if you see better, you can perform better, you can achieve good quality of education, and if you have education, you can have a better quality of life, can get to better areas of your daily functions, and also be a part of national growth in terms of economic growth as such. So if you look into a major cause of blindness and visual impairment in our country, we all know cataract is a significant cause. More than 60% people would suffer from a cataract blindness. Corneal blindness has come up in recent years, especially the disorder which affects the cornea, the corneal opacities, and uncorrected refractive error. In this, I think the major challenge for us for future going to be a presbyopia, because we do have a large segment of people suffering from presbyopia, and they are uncorrected. The word uncorrected is a very important aspect, because in periphery, hardly anybody has the correction for presbyopia. Glaucoma and diabetic retinopathy, ARMD, is going to be there, and it's going to be a major challenge for future. So looking in this publication from RP Center, it says that almost 93% of people have opportunity to avoid the blindness. These are avoidable blindness, and 97.4% are avoidable visual impairment causes. The major chunk is can be avoided. Therefore, the policy has to be there to implement in such a manner we avoid these blindness to happen. If you look into causes, if you divide treatable causes, we know refractive error, aphakia, cataract, they can all be treated and come back to normal or better than normal sometimes. And major area is the preventable causes. In that, we know that the primary eye care services is a major area which should look into corneal pathologies, trachoma, injuries, infections, and the other surgical areas of glaucoma, cataract, diabetic retinopathy, and most importantly, look for a prevention of trauma in children and adults, especially working group of people also. So it's not that policy which government makes is has to be there. It has to be government and non-governmental organization to work together to implement these policies to decrease the avoidable or treatable blindness from our country. The current areas which government is looking is one is basically a NPCV, that is blindness control program, in which various surveys have been done to look into a various causes of blindness in last 4 or 5 decades. In that, the RAP survey, trachoma control programs, cataract outreach program, now a school vision screening and eye banking. These are 4 or 5 major areas from the government point of view to look into a various surveys to assess the blindness prevalence in our country. Then other area which we are looking for is building the infrastructure, not only in the tertiary care area, for secondary and primary areas where we need to develop the infrastructure. So once we have the infrastructure, the manpower will come, and we can train the manpower of that area, especially the people who are available there, ASHA workers and Anganwadi workers, or we can have teachers also educated to fulfill this area of primary health care in remote places. Other areas which we are doing is social welfare schemes, In that, Prime Minister's PMJ and Janani Shishu Suraksha Yojana, where we treat free of cost the mother and the infant for first 1 year for any disorder or disease, even affecting the eyes also. Then there are various screening programs which are going on, basically on the lifestyle change disease like diabetic retinopathy. Glaucoma is one of the area which we are working on, and other challenging areas, the school vision areas also. Let me briefly take you to the NPCB program, that is initially a National Control of Blindness program, which was initiated in a long time back in 1976. After the initial ICMR survey, which was done between 71 to 73, and at that time, we had trachoma control program attached to a blindness program, which started way back in 1963. And unfortunately, it is not yet a closed chapter for trachoma in our country. It was totally 100% centralized sponsored scheme to begin with. Currently, it is 60-40 for a states, and for a state like any and Jammu and Kashmir, it is 90-10. That is a centrally sponsored program. The other important area of concern is it has a reach up to 700 districts of India. That means it reaches almost every part of the country and looks into a blindness in these areas. In fact, it is under the non-communicable disease under National Health Mission, where we are going to look this beyond 2020 to improve the quality of vision in these areas. You all know these were the objectives of National Program Control of Blindness. Basically, major areas to decrease the backlog of blindness. And backlog today is majorly cataract, because we consider cataract backlog can be treated and we can actually get the patient back to work with a good vision in these patients. Apart from that, these are various aspects which we are looking for. Most importantly, I would think of enhancing the community awareness in eye care, because I personally feel unless the education reaches the masses, any scheme is not going to be successful. It is the learning of a people, understanding of people who are actually the consumers. Nothing will succeed in those areas also. These are target areas, cataract to diabetic retinopathy, and the goal is to reduce the blindness prevalence to 0.03% by 2000, which was subsequently revised to 2020, and under the national health policy to decrease the blindness to 0.25 by 2025. Have we achieved this? So this is the surveys we have done. If you look into ICMR study, the prevalence of 1.38. Now today it is 0.036. And if you look into the idea was to decrease to 0.3. In 2019, we have achieved 0.36. So if you look into prevalence comparison from 2010 and 2019, there are two studies done by RP Center. At 2020, it was 5.30. Now it is 2.55. In terms of blindness wise, there's a almost 52% reduction as compared to the 2010. And in decreasing the blindness compared to 2010, it is 47% decrease. So this 52 and 47% decrease from 2010 to 2019 is a very significant achievement in our blindness control program. And in fact, 0.36 is, it will come down by 2025 to 0.25. So we are going the right path in terms of looking into a blindness control program as such, in terms of preventable blindness wise. Cataract still is the highest, because it was 2001 62%, still it is 66%. The surprising thing is refractive error has decreased from 2001 to hardly any important area, because that means our reach for a refractive correction has increased, and the cataract surgical blindness has also decreased. That is a very important point here. It has come to 7.2%, which was earlier around 19 to 20%. So that is a significant change which has happened, because sometimes we do large number of cataract surgery and still produce blindness because of cataract surgery. The next important thing which has come out is a corneal related blindness, especially corneal opacities and other disorders, which is a significant number. And if you look into less than 50 years of age group, their corneal blindness is number one. So people have to work on a corneal area also to look into these aspects. If you look to diabetic retinopathy and glaucoma, the percentage is less. But if you look into people suffering from diabetes and glaucoma, it would be higher than a cataract patients in long run. So these are area we have to look for these cases. These are key activities from government supporting cataract surgeries, supporting school health screening, especially giving free spectacles to school children. Unfortunately, the number required is a huge, but the providing spectacles from government sector is very, very less. I'll come to that point also. Then donor corneas collection, diagnosis, treatment, diabetic retinopathy, government is going to support all these programs. And as I said in the beginning, infrastructure development is another important area which you look for. And education monitoring is a very important area also. This you all know how much is the financial help given by the government to various surgeries. And more importantly, cornea collection is supported by government, and that is going very important area. In fact, iBanking organization or establishing iBank government supports on government setup by rupees 20 lakhs to begin with. So making India cataract free is very important aspect, especially COVID. The new program is going to come where we have to do more than 2.5 crore surgeries in these 2 years, and we do around 40 or 50 to 60 lakh surgeries, and that has to be doubled every year. I'm not sure how we are going to do with the same infrastructure and same manpower. Ayushman Bharat is a very successful program being organized by the government since 2017. And this has basically two health and wellness centers been established. And this PMJ program looks into various areas of concern, all medical health required. In terms of ophthalmology, there are at least 42 procedures been categorized in this, and cataract is one of the largest segment in this group of cases. The other important area was for us is, these are which we do, Janani Shishu Suraksha Karikaram and Rashtriya Bal Suraksha Karikaram. These are things which we cover all people under this. Then employment schemes, it may be EHS, CGHS, and CHS. A lot of other things are there, which government controls. This is RP Center's involvement, where we do a lot of free work for these patients. School screening program is a major aspect for our government now. We are looking to cover almost every school, if possible, in the country. Train the teachers to assess the vision in these patients. If any poor vision is seen, then optometrist is concerned. Optometrist does the refraction. If there are any disease process, then ophthalmologist is taken into account, and subsequent treatment is done. This is a chart which is placed in every school where it is correspond to 6 by 9, and teachers are supposed to do these. iBanking, you all know, 1945, the first iBank established in RIO Chennai. Since then, we have a significant number, around 72 iBanks are listed. Only 149 are active, and less than 10 iBanks are there where they do more than 1,000 transplants. So this has to increase significantly. In recent time, SCRP has taken over in terms of collection. More than 50% or 60% eyes are collected through SCRP program. Trachoma, as I said, it started in 1963. In 2017, we could declare active trachoma free from the country. Now we are doing a survey in 200 districts of country in endemic zones, which were declared in 1963 by WHO. This year we complete the entire survey, and this will be declared, the country will be declared trachoma free ultimately in 2023 after almost 70 years. These are new areas we're looking for, corneal opacity areas, doing a new survey across the entire country to look into important aspects of a corneal blindness, and subsequently improving the eye banking, transplants, education, teaching in these areas also. These are this was a belt where we had an endemic cornea trachoma related problems. Now we are doing the other surveys to look into trichiasis and corneal opacity. I'm going to summarize this. These are other programs which we do. Orbis is another area. Just to highlight here what is the discrepancy we have. This should have been the actual pyramid in a government setup, but you can see this is the little offset pyramid which is there, where we require more vision centers, which are supposed to be 20,000. We have only 4,000, so we need to increase this area also, and have the ophthalmic assistants serving these areas also. These are primary care area which we annually do it. Large number of cases are done through this, and these are service provided in these vision centers. These are basically primary healthcare areas, And we have really achieved a significant decrease in the blindness from 1.34 to a 0.36 prevalence, which will come down to 0.25 subsequently. These are various challenges for removing the preventable blindness from our country. Major load is cataract, and future is diabetic retinopathy, glaucoma, and ARMD going to be there. I think universal eye health can be achieved in the country with the support of government and the NGOs which are going to come. These are future roadmaps which I see that this has to be taken care of. Myopia, presbyopia, diabetic, and the macular degeneration are going to be a major challenge for future for all of us, especially presbyopia, where we have various organizations working on giving free spectacles to children and presbyopic people. Last year, I think we could give around 9 lakh spectacles in this area. Requirement is almost 2 crores. So this is a difficult time where government has to upgrade their policies and take all the NGOs and private sector with them to achieve these difficult tasks for future. Thank you for